Telehealth. Everyone's heard of it, right? But until this COVID-19 pandemic, many physicians had little or no experience with it. So if you're new to telehealth or you just need a refresher, let's get you up to speed on the basics. Whether you're at home or in your practice, you'll need the right technology. That includes a laptop or computer with video capability and a reliable internet connection. The Medicare requirements suggest you use video conferencing in preference to phone conferencing, if both you and the patient have the capability. Any video conferencing platform is permitted under Medicare requirements. On your video conferencing platform of choice, the Australian Government recommends using a clinic account rather than your personal account. Similarly, for phone consultations, you may want to use a dedicated work phone rather than your personal phone, even if that means a second mobile device. Also, out of concern for privacy, make sure you're in a private area if you're at home. You'll need to consider whether you have remote access to your medical records. If you're unsure, it's best to double check with your indemnity insurance provider that they cover you for telehealth. But according to their websites, telehealth is covered by Avant, MIPS, MDA National and MIGA, as long as you and the patient are both located in Australia and you're working within your scope of practice and level of competence. You'll need to consider triage and appointment making. Not every appointment will be suitable for telehealth, and some will likely still need to be face-to-face. Under MBS requirements, in a telehealth consultation, the practitioner needs to be able to provide the full service safely in accordance with professional standards, and it needs to be clinically appropriate. So have a triage process in place to determine whether a telehealth appointment is appropriate before the consultation. You'll need to consider how the consultation will be billed. You'll be using the new temporary COVID-19 telehealth Medicare items. All temporary item numbers for consultant physicians are listed on MBS Online. Now that you're set up, let's move on to what you'll do during the consultation. Firstly, allow extra time for the consultation. There's always the possibility of technical difficulties or connection issues. Explain to the patient the process of the consultation as well as the limits of telehealth. Get their consent to have a telehealth consultation. Record their consent and your discussion with the patient in your notes. Also get the patient's consent to bulk billing if you were using it. Due to the current crisis, verbal consent to bulk billing is legally sufficient. Again, record their consent in your notes. Documentation is really important in telehealth consultations. You should also document whether it's a phone or video consultation. If you're unable to use video, document the reason why. You should also document that you're providing this service during the COVID-19 pandemic. While you will have triaged the patient prior to the consultation, you will also need to assess during the consultation whether it is safe and appropriate, or whether a face-to-face consultation will also be necessary. Any prescriptions you provide will need to be electronic. Technology that allows you to generate electronic prescriptions is becoming progressively available. Electronic prescriptions are sent directly to the patient as tokens via app, SMS or email. You can find the most up-to-date instructions for onboarding your clinic at digitalhealth.gov.au. Alternatively, you can also create a paper prescription during the consultation and then produce a separate digital image of the prescription, a photo or PDF, that is clear enough for the barcode to be scanned. Send this to the patient's pharmacist of choice. Okay, so what happens after a telehealth consultation? Of course, follow-up, referral, ordering tests and so on are all still necessary. Exercise caution if using email to follow up and communicate with patients. For example, you may want to use password protection for any attachments that contain sensitive information. I've brought you up to speed on some of the basics of telehealth, but remember, not all telehealth consultations will be perfect. During this time of pandemic, there are going to be some trade-offs. It will be easier for some than others, but you can provide care to patients using telehealth. It will just be a bit different.